How are brain tumors precisely removed from healthy tissue? Imagine trying to remove a delicate stain from a fine fabric without damaging the surrounding material. That's similar to what brain surgeons do when they remove tumors. The goal is to take out as much of the tumor as possible while keeping the healthy brain tissue safe. This is important because healthy brain tissue controls vital functions like movement, speech, and memory. To do this, surgeons use a combination of advanced tools and techniques that help them see and differentiate tumor cells from normal tissue in real time. One of the most helpful tools is neuronavigation systems. Think of these as a GPS for the brain. They create a detailed three-dimensional map based on preoperative scans, guiding surgeons with millimeter precision. This helps them target the tumor accurately and avoid critical areas that could cause neurological problems if damaged. During surgery, real-time imaging like intraoperative magnetic resonance imaging or computed tomography scans is used. These scans show surgeons how much of the tumor has been removed and if any residual tissue remains, which might not be visible to the naked. Another exciting advancement is the use of fluorescent imaging probes. These are special dyes that cause tumor cells to glow under certain lights. When injected into the patient, they bind to molecules that are absorbed more by tumor cells than healthy ones. During surgery, the surgeon can see these glowing areas, helping to clearly define the tumor margins and avoid removing healthy tissue unnecessarily. This visual aid makes a big difference, especially with tumors that infiltrate into surrounding tissue, like glioblastomas. Molecular testing during surgery also plays a key role. Techniques like rapid droplet digital PCR can analyze tissue samples instantly to identify genetic mutations and determine how dense the tumor cells are at the edges. This information helps surgeons decide when to stop removing tissue, ensuring they get as much tumor as possible without harming healthy brain parts. Some surgeries are now minimally invasive or robot-assisted. These methods use smaller openings and robotic tools that allow for steadier, more precise movements. This reduces trauma to the brain and speeds up recovery. Laser interstitial thermal therapy is another option. It uses a tiny laser to heat and destroy tumor cells through a small hole in the skull, sparing nearby healthy tissue from physical disruption. The challenge with brain tumors, especially infiltrative ones like glioblastomas, is that tumor cells often spread into healthy tissue without clear borders. This makes it tricky to remove all cancerous cells without risking damage to essential brain functions. That's why the goal is to achieve what is called gross total resection, removing as much tumor as possible, while preserving neurological health. All these techniques work together to help surgeons balance the need for thorough tumor removal with the importance of protecting healthy brain tissue. Patients benefit from safer surgeries, fewer complications, quicker recoveries, and better quality of life. Since each tumor is unique, surgical plans are personalized by teams of specialists to give each patient the best possible outcome. Remember, always consult with a healthcare professional for individual advice and treatment options.